So we presented data at AACR on the KeyLink-007 trial, which is a tumour-agnostic study of Olaparib plus pembrolizumab in homologous recombination repair mutation and homologous recombination deficiency-positive advanced cancers. We know that mutations in homologous recombination repair genes or HRD rely on PARP enzymes for DNA repair, and increased DNA damage promotes immunogenicity through activation of STING and NF-kappa B, which leads to a pro-inflammatory signal release and increased immune cell infiltration, and it also leads to adaptive upregulation of PD-L1. So in this phase 2 TM-agnostic trial, we assessed this combination in molecularly selected patients. And by using this tumor-agnostic strategy, we were able to actually assess tumor indications outside of the current approved disease settings at the time of trial start. So in this clinical trial, we assessed patients in three different subgroups, and all of these patients were actually stratified according to centrally confirmed tumor biomarker status using the Lymphasa HRR-HRD assay. In subgroup 1, we assessed patients with BRCA1 and BRCA2 mutation tumors. In subgroup 2, we assessed patients with non-BRCA but HRR mutation tumors. In subgroup 3, we assessed patients with HRD-positive tumors without HRR mutations, but with a loss of heterozygosity score of at least 16. To the best of our knowledge, this was the largest data set of molecularly selected patients with HRR mutations or HRD-positive tumor-agnostic advanced cancers treated with PARP inhibitor plus anti-PD-1 or PD-L1 inhibitor combination therapy. And in this phase 2 tumor-agnostic trial, the KeyLink-007 study, we observed that this combination of olaparib plus pembrolizumab showed promising anti-tumor activity, particularly in BRCA1 and BRCA2 mutation cancers, where we observed a median duration of response of 19.1 months. In addition to that, we observed early signals of durable anti-tumor efficacy in patients with molecularly selected tumors in indications where olaparib and/or pembrolizumab are not currently approved. And currently, biomarker analysis is ongoing for other biomarkers of response.